Excellent. Yeah, so I am Katelyn Waters. Thank y'all so much for having me here tonight. I'm a veterinarian and I'm a theriogenologist. I currently work at Auburn University. I'm an assistant clinical professor there. I work mainly with the fourth year students on their clinical year. I'm in the teaching hospital and I do in-house work and ambulatory work. So I see food animal patients and I also see small animal patients on our theriogenology service. And so I'm excited to be here tonight and thank y'all so much for having me. Then I'll go ahead and share my screen.
Yes, that's right.
Is the Zoom thing? Okay. Okay.
Yes,
All right, perfect. Y'all can see that now?
yes,
Okay, excellent. All right, so ready to get started? Is it okay?
yes, please.
Okay, excellent. All right. So tonight we're going to talk about small ruminants and then health programs. We're going to have some emphasis on entering those winter months when it gets a little bit harder, right? So the cold is going to exaggerate some of our diseases. We're going to have more diseases that come into play just because of some things that go on. And so we'll talk about all of those. So just a brief outline. So we'll talk about biosecurity. That'll go across kind of like yearly, but it'll also talk about some of the winter months. We'll talk about our overall health status. And this is where we're going to spend a lot of our talk tonight is just that overall health, making sure that they're healthy before they go into the winter months so that we can sustain really well and easily in those winter months, especially if we're kidding or lambing in those winter months, because then it's going to even add an extra level of necessity for nutrition and things like that over those months of cold weather. And then we'll talk about gestation management. This is going to focus a good bit on the winter months, but then also just kind of overall management of those pregnant does and ewes. And then we'll talk about a couple different common diseases. I put these in here because there's a few things in the winter. We end up feeding more grain, right? Because it's colder outside. And then a lot of times we're coming out of the breeding season. Maybe we're trying to put more body condition even back on the males. And so talk about things that can happen with the males. And then we're going to talk about pregnancy toxemia also in the females, a very broad overview, because that is something that we see really frequently and just trying our best to provide y'all ways to help prevent that or recognize it early so that we can treat those girls. And then we'll just briefly talk about the veterinary client-patient relationship and what that means to us and how we can do the most together to provide y'all the best care and to keep everything healthy and moving. So biosecurity, so that's going to be our management protocols that we set in place to prevent the entry or spread of disease. And so all of these are things, and every farm will be a little bit different, right? So depending on what your setup is, how much land you have, if you have a barn that you're going to put these new animals in, if you have a sick pen that you put them in, if you have a sick stall, what have you, wherever you're going to put those new animals or your sick animals to try to keep them away from the healthy and from the young ones so that we don't have disease spread. So some of the protocols are going to include what we're going to do with our importing of our new animals. And so any new animal that enters your farm should be quarantined for at least 21 to 28 days. And so what this does is it gives time for any diseases that they're bringing to try to go ahead and declare themselves so that you can see it, so that hopefully you're not going to put it into your herd. One of the best ways to not put it into your herd is to just go ahead and buy from farms that are disease free, knowing where these animals came from. And so we want to avoid the sale barns the best we can. And so when I say sale barn, I just mean the mass sale barns, not specific sheep and goat sales that are put on by farms, if that makes sense. And so with every animal that you bring onto your farm, it's a really good idea to go ahead and get that CVI, so a certificate of veterinary inspection, because that means a veterinarian has evaluated that animal. And at the time that that animal is being transported to your farm or you're transporting it from the place where you bought it to your farm, they were apparently healthy at that time. And so that's a really good kind of insurance policy for at least right then that what you're getting is a really healthy animal and you're bringing in a healthy animal to your farm. And then I think it's always a good idea, especially when you're buying from farms that you know and people that you know, to just request the records for the animal. You can, or even just if they'll just tell you what they vaccinated them with, or vaccinated what time of year, that sort of thing. And then also and we'll talk more about this in another slide, but the parasite status, I think when you're purchasing new animals is maybe one thing that kind of gets forgotten about a little bit, but I think that's a really good way to try to not bring in those persistently high or the high shedders into your herd. But we'll talk more about that. So when we think about quarantine these new animals, we want no fence line contact, right? We want at least somewhat of a gap. Best we can, try to keep those animals as far away from our healthy animals and our closed herd as you can. We want to avoid pens that are close to our young, right? So we want to keep the pregnant ones and the young ones far away from our new herd. And then when you bring these animals in, we're going to talk a lot about parasites tonight, but I think it's a really good idea to do a fecal egg count. And in my role as a veterinarian, I do a lot of fecal egg counts, and I talk a lot about parasites because in the Southeast we see a ton of parasites, and so it's hot, it's humid, and so we have problems. Even in the winter months, we have a lot of issues, and so that is one thing I was going to tell y'all too, is that I live in Alabama, and so our winters are very different than other places. I know we have some folks from Canada, which is incredible, but our winters are going to be a little bit warmer, I do believe, than y'all's. And so at Christmas, it was quite warm outside. I think I had on a t-shirt this year, and so it was in the 70s. And so we still think about parasites in those December months. But doing those fecal egg counts upon intake, I think is a really good idea because you know exactly where you're starting with those guys. And then you can also do another one before you turn them out to just see if we have any elevation, because maybe they were dewormed right before they got brought to the farm. So daily observations of these quarantine new animals. So we're going to look for nasal discharge, for ocular discharge, any kind of lamenesses or joint swellings, any kind of lesions on the mucous membrane, so on their mouths, their eyes, or their coronary bands. I think that's pretty well known that those are big deals if you find lesions on the mouth and the coronary bands, and to contact your veterinarians, and then we'll help try to decide what the etiology of that is and make sure that there's nothing bad. And then look for fecal staining too, because this is going to be indicative of maybe we got diarrhea. So do we have parasites or a different disease that can also cause diarrhea? So some diseases to always think about when you think about these biosecurity. I've got them listed here. I'm not going to read them to you, but there are a plethora, right? And so just trying to make sure that you have established, especially if you have a herd that is established free of these. And so a lot of the herds that we go to, we do a lot of disease testing and try to be disease free and all the things. And so if you're bringing new animals in, just make sure that you know what diseases they've been tested for, especially if you're marketing animals that come from a disease-free farm. And then permanent identification, they should have one before they get to your farm, but if they don't, make sure that you have one placed on them. And then the records, I put here, write it down. If you're anything like me, if you don't write it down, then you'll forget. I only have one pet and I still have to write it down because I forget about his things all the time. And so writing down the details of your herd. So talking about vaccinations, so I think across the board, the kind of universally accepted, the universal core vaccine that we think about when we think about small ruminants is going to be our Clostridial vaccines. And so when we think about the Clostridial vaccine, this is the most common one that we use here. And so it has Clostridial C, D, and T protection. And so that's perfringens C and D, and then also Clostridial tetani. This is really the only core vaccine. It is labeled for both sheep and goats. There are other vaccines out there. Some of them are labeled for sheep, but not for goats. And so just keep that in mind if you're going to add more vaccines into your herd protocol and things like that. So when we think about when to vaccinate these guys, it usually, if we're starting from birth forward, if we have dams that have been vaccinated prior to breeding or prior to parturition, those offspring should get maternal antibodies from the colostrum. And so about 6 to 8 weeks of age is when those maternal antibodies start to decline. So that's when we want to go ahead and booster them or give them our initial, and then we'll booster them in 3 to 4 weeks. If you have an animal or a bottle fed baby or an animal that you don't know if it got failure or if it got adequate colostrum, then it's a good idea to go ahead and vaccinate them a little bit early. This vaccine is really safe. It's a really effective vaccine, and it's a really inexpensive vaccine. I think the whole bottle here, which gets you 25 doses at our hospital, I think it's like $12. And so I think it's a very cost-effective way to prevent disease in your herd. And then on our adults, we're going to booster those guys every 6 months to a year. We used to really only booster a year, but we've seen more and more where we're going closer to 6 months, and we even have one herd that is a dairy goat herd, and they booster it every 4 months. And so I think it depends a lot on how much grain you're feeding. Are you worried about Clostridial disease, Clostridial enteritis from high levels of grain being eaten by those animals? And so I think it just depends on your herd and your setup. But every 6 months to a year at minimum. So when we think about giving these vaccines, there's two different places in small ruminants that we like to administer injections. So that's going to be the triangle of the neck, and then behind the point of the elbow, we like to use a 20 gauge needle, 1 inch, and then we like to give it sub-Q. And so this circle here on this little image here is showing you where to give the injection behind the point of the elbow. And so I always tell the clinical students, especially when they're first learning to give these injections, if you'll tint the skin out like you're kind of thinking about a cat, and then you'll take your needle and go kind of parallel with the body, like downward, and don't go straight in. That way, if the little goat or little sheep moves, you don't accidentally enter the thorax. And so, because they do tend to wiggle. So the other option for where to give this is going to be in the triangle of the neck. And so our landmarks for this are illustrated here. And so our cranial border is going to be that nuchal ligament. So the nuchal ligament runs right along the top line of the neck. And then we've got the cranial border of the scapula. So the scapula is right here underneath this hair. And then their cervical vertebrae run a little bit lower on their neck than you think they would. And so that's going to be your caudal border. So right here in the middle of this triangle of those borders is going to be where we want to give those injections. I will tell you that sometimes this vaccine tends to give them little injection site reactions. And so if these are for show animals, I would give it behind the point of the elbow, just because it's a little bit easier to hide if there is a little bit of injection site reaction. And what I mean by injection site reaction is sometimes they'll have like a dime size knot right there. They usually don't amount to anything, but a little bit of an eyesore. They're usually not painful or anything, but they do form. I just included this here for everybody so that y'all can have this if you would like it as a resource. And so this is from a chapter from 2020 by Tizer. And so this is a great chart for vaccines and all of the different options that are available. Some are labeled for sheep and goats, some are not. And so if you are going to a show and things, just make sure you're following the extra labeled drug use and not I would do this concurrently with a veterinarian if you're going to use a vaccine that's not labeled for a sheep or a goat. And so I just put this here so that y'all could have it. But like I said, the core is going to be that Clostridial CD&T. And so we're at our first checkpoint, our first question.
Let me go through the poll so the people can answer.
Okay.
Let me see which of the following. Okay, I think it's this one. Okay, the people start answering. And once that they answer, I will be showing the results, and you can give feedback to the people. How the people is answering, like yeah, the people can answer in the poll, and some of them are answering in the chat. I think I will be in the poll now. Share the results. So in the chat, many of them answer that the correct answer was 8. And for the people that answer in the polls, 69% says that the D, none of these are correct. So what is the right answer?
Yeah, so for me, A is the correct answer. So and maybe it should say all adult animals should receive a clostridial vaccine booster every 6 months to a year. But A should be the correct answer. And so when we think about these guys, we want to booster them at least every year. Some herds will do it as early as every 4 months and then every 6 months. We personally do ours every 6 months in our herds here at the university. But that's going to be the answer for that one.
Okay, thank you.
Yeah. All right. So onward we go. So on to overall health. So winter preparation. So I'll tell you that in my experience, we don't do a ton of extremely large small ruminant herds. I think some of our largest probably have 100, 150. So we don't see many 500 head operation of small ruminants in my location. So a lot of this has to do with a little bit smaller operations, but it can still be extrapolated to those big operations. And so management, when we think about the winter months, we need to make sure they have some kind of shelter or trees or something to help protect from the weather. And so want to make sure they have a dry area and then a shelter. I really like when we can make a gestation pen just that's a little bit cleaner, that the animals haven't been in, that only the gestating animals are in, and they get moved there kind of right before they start to kid or lamb. And then I also really like to have a nursery if possible. That way they can move into an even cleaner environment after that gestation, but you can have one in the same, right? So we can have a gestation pen that ends up being our nursery, right? So I guess for lack of a better term, the kidding and lambing pen would be a great way to put that. Um, and so just making sure that they have somewhere dry. In the southeast, it's really hard to have somewhere dry because it is humid and it is wet. And so that can be really difficult sometimes for our producers. And so the next thing is going to be to ensure adequate nutrition. And so we feed a lot of hay down here, but making sure that that's a good quality hay is one big thing. And then if we can have winter grazing, that's amazing. But if y'all states were anything like ours this year, we didn't have much rain, and so we don't have much grass this winter. And then providing free choice minerals, I think, is a really great idea and a really necessary strategy for that. And so I prefer the loose mineral to a lick tub just because those lick tubs have a lot of molasses and things like that. And so you get a little bit more bang for your buck sometimes with those loose mineral bags. And then I am a huge proponent of getting involved with a nutritionist for your herds. Like I said, my specialty is reproduction, and I love working with the nutritionist because it is so intricate and it is so detailed. And some really small things and changes in your nutrition plan and in your feeding can really change your whole production herd outcome, and it can save you money and time and things like that. And so I think it's a really great thing to have. And the extension agents are always so great about coming out and helping everybody work through and then working with the veterinarians. And so it's always a really great interaction. So overall healthy, like I said, reproduction is where I spend most of my time. And so we've got to be productive to be reproductive. And so we got to make sure we have healthy animals so that we can go ahead and have more offspring for the next year. Parasite status, small ruminants. I always tell our producers, if you got small ruminants, you've got parasites of some level. And then when we think about parasites and who's carrying those, 80% of the parasites are carried by 20% of the herd. And so if we have 10 animals, 2 of those are usually going to be the ones that are reinfecting the rest of your herd. And so identifying those guys, and we'll talk more about that in just a minute when we talk about parasites. And then nutrition status, we talked a little bit about the free choice minerals versus a lick tank. I think money is better spent sometimes on those free choice or loose mineral versus the lick tanks. And then conformation, when we think about that from a reproductive standpoint, we usually think about the males. We'll talk about the mammary gland in the females in just a minute because I think it's a good thing to look at, especially before you go into lambing and kidding and before you go into the winter, to make sure you're going to have adequate milk and things for those offspring. And then low stress handling. I think this is a really big thing because it really does change the whole interaction between the animal and the producer and the veterinarian. If we do these as calmly and slow as we can. slow but efficient. So our breeding animals, when we think about the reproductive conformation, and we're not going to talk a ton about the reproductive conformation, I guess, all the way across the board, but I really like thinking about the mammary gland because there's a lot of times that we have issues, especially with the kids not getting adequate colostrum because we end up with a bad mammary gland, a mammary gland that is has really poor teat conformation, and then we end up with bottle teats, and the little lambs and kids can't nurse. And so making sure that before you head into that lambing and kidding season, that you have a mammary gland that is going to allow those kids to get that colostrum that they need. And then when we have poor conformation, it also leads to bottle babies, which can also be a nice experience, but then they add extra work to your operation, right? So when we think about these mammary glands, we want to have them at the level or above the hock. And so we can see here on the left that this mammary gland, it's very close to the abdomen. It's not sagging below the hock. There's no bottle teats present. It looks really great. Versus the mammary gland on the right here, it has a bottle teat and almost looks like a mass beside the teat on the right side. And then it's hanging below the level of the hock. And so multiple things are going to happen. One, those kids aren't going to be able to nurse as well as they would have otherwise. And then also, if this mammary gland continues to get larger, it continues to start to sag down, could end up dragging the ground. She could accidentally step on it. And then that leads to a whole plethora of problems, right? And so the stepping on it happens, I feel like, a lot once these mammary glands start being lower than the hock, just because when they go to get up, they step on it. So parasites, so when we think of small ruminants and we think of parasites, we think of the hot seat complex, right? So that's Homunculus contortus, and that's the big one that we think about in these guys. That's our barber pole worm. We know it sucks blood, and then these animals can become anemic. We also have Ostratasia, the Trichostrongylus, and the Couperia. Those guys do affect small ruminants, just in less talked about because Homunculus is so proliferative in its life cycle, and it's so detrimental when they are anemic and things like that. So also, the other thing we'll talk about, especially in these winter months, is going to be external parasites, right? And so it gets cold in the winter months, the animals start to congregate together for warmth, things like that, or they come into a barn in the winter months. And then, so if one animal has lice, then they tend to end up all having lice. And so one way we like to treat lice here is going to be this Ultra Boss. It's a permethrin, and so it works really well. And then with mites, you'll see itching with lice and mites. The mites you usually have to treat with injectable ivermectin, and then you can see the lice on the animal, where mites you can't always see. Sometimes you have to get a skin scrape and look under the microscope for those guys. And so just acknowledging that there's internal and external parasites that we have to worry about in these guys. So when we think about the parasite status, we're going to look at our FAMACHA score. And so for FAMACHA, it was developed to look at the anemia status of these animals. And so when we think about these guys, the conjunctiva on the inside of the eyelid is where we're going to look. And on the right-hand side of our screen here, we've got the score. And so it's a 1 to 5. 1s and 2s are great. 3s are questionable if they're anemic or not, or are we borderline to deworm. And then 4s and 5s, we pretty much always deworm because we're extremely anemic. And so when you go to do these, and you can take a whole course to learn how to do the FAMACHA, and then once you've done that, once you take the course, they send you a card. And so the cards are very nice. And so the vet students always love the cards, like they're excellent. And so the easiest way to look at these conjunctiva is if you'll take your index finger and place it on the upper eyelid, you'll push in just a little bit, and then you'll roll down the bottom eyelid with another finger, and then the conjunctiva will pop out for you like it's seen up here in this number 1 on the FAMACHA score up here. And so FAMACHA is excellent. It is a very good indicator of anemia, and it works really well when we put it concurrently with a McMaster's egg per gram, or fecal egg per gram. And so what that's telling us is how many eggs per gram of feces we have. And so with Homunculus, they have they proliferate eggs a lot. And so they can have a lot of output with a few adults. And so what we do is that we take this, we'll collect feces, and then these grids on the slide here that you can see at the bottom of the screen, You let it sit for 5 minutes after you followed a series of how to set up the fecal sample, and then you'll count how many eggs per grid, and then you multiply it by a constant, and then that gives you a number. And so the number that we like in small ruminants is going to be less than 1,000. And I think that when you get to know your herd's parasite level really well, when you get to those animals that are going to be like 1,000 to 1,200 and 1,500, if you have animals that you're doing serial McMasters on and identifying the ones that are high shedders or identifying the ones that are kind of the middle of the road, then you can kind of make individual based decisions on those. Now, granted, this is going to be more realistic in an operation that doesn't have 500 animals, right? So this is a more, maybe we have 30 or 50 animals that we can do individual ones on and say, she was 1,500 last month, she's 1,500 this month. And so maybe that's just where she's going to stay and we don't want to deworm her right now, especially if she has a really good FOMACHA score. And so using these two concurrently is extremely helpful. And well, we do this on a daily basis, I think, in my life anyway. And then the other thing that we need to look at when we think about parasites is going to be the fecal consistency. It should always be pelleted. If it's anything but individual pellets, then that is diarrhea. So things to look at when you're thinking about parasites. So over here on the left, we've got this little sheep here that has bottle jaw. So what happens is that the parasites suck blood, albumin follows behind it. Albumin's responsible for holding fluid in the vessel. When the albumin goes low, the fluid begins to leave the vessel and it goes to the most dependent portion of the body, which in this sheep right here is going to be the jaw. And so we have a fluid accumulation there. On the right here is just another example of the FOMACHA score being performed. So pushing in on that top eyelid, rolling the bottom one down, and then evaluating that conjunctiva. I think one thing that can be confusing sometimes is that right there on the inside of the lid, it'll look a lot paler than they actually are. And so it's just the anatomy of the eye. But when you get this conjunctiva, you really want to look kind of far back to make sure that you're getting an accurate reading. And then this bottom picture here is just kind of like a dog feces like consistency in the feces. And so sometimes I don't think we identify this as diarrhea, but this is considered diarrhea in these small ruminants. So the new additions to the herd, we need to think about their deworming history. We can look at their fecal egg counts individually and see, do we have any that are already have a high egg count? Things like that, especially from a biosecurity standpoint. And then control, when we think about control across the board, whether it be our new additions or our current herd, pasture rotation is a really great way to mitigate this because the feces is where the parasite lives. So they defecate the larva out, the larva hatch as they sit on the pasture. And then once they hatch, the larva climb up the grass and then the animal ingests the larva on the grass. And then the life cycle starts back over, goes to the abomasum, and then eventually is defecated out. So things that we can do is we can rotate. And so ideally we would rotate pastures every 3 to 5 days. That is not realistic in a lot of cases. And I would say the majority of the cases, that's not realistic, right? We only have so much pasture, we only have so much land. And so things that we do to navigate that are going to be the grass height. So we'd like to keep the grass at least 4 inches tall because the little larva can only climb up so high. So 3 to 4 inches is about as high as it can go. And so when the grass starts to get eaten down and is overgrazed, that's when we really start to see parasite problems take off. And then we can elevate our feeders, so feeding the hay and the grain off the ground so that they're not eating where they're defecating. We'll talk about deworming and alternatives. You can house your high shedders together, and this is one thing that I like to do personally with my clients is that we group those animals that we know have chronic high counts together, and that way they're not reinfecting the herd that aren't high. And then culling resistant animals, and we'll talk about how to know if they're resistant or not. So when we think about resistance, we think about an animal that we have identified has a high egg count, we deworm them, and then we come back in 10 days, we do another fecal egg count and see if we have a decrease in the number of eggs present. And so in 10 days, there should be a 90% decrease in the number of parasites. And so if they were 1,000, we want them to be 100, right? And so if there's less than a 90% decrease, then we know we have some level of resistance. And I think there's a lot of animals out there that have parasite resistance with our dewormers, but just knowing which animals those are and navigating that, especially if you have especially if you're a pet operation, because inevitably it's the favorite that's going to be your high shedder, right? It's the sweet goat that comes up to the fence and all the things. And so navigating that can be kind of hard. But this is a great resource, wormx.info. I really like it. I don't have any affiliation with it, but I think it's a great website. It's really easy to follow and go through. So when we think about deworming, we think about triple dewormers. And so what we mean by triple dewormer is that we use 3 different classes of dewormer at one time. That way we kind of hit the parasites hard and we don't have a lot of parasites that don't get killed. We want a few left over, so we want refugia, that parasites we know we can get rid of if we need to, but we usually do a triple dewormer here. So things that you can do to make sure that we don't add to parasite resistance are going to be ensure that the weight is accurate. And so often we figure out how much the biggest one weighs, and then we kind of titrate down from there. And it can be hard. To me, guessing weights is one of the hardest things that I do because they're variable, right? They're variable based on if it's a sheep, there's wool, right? If it's a goat, there's hair or fiber, right? And so it can be really difficult to tell their weights. And so making sure that we have accurate weights. And then we don't recommend rotational deworming anymore. And then we also don't recommend giving injectable dewormer orally. I've had a few questions here lately about those. And so the animals have done fine with it, but there are, and usually it's ivermectin. And so there's labeled oral ivermectin. And so that's what I would give if you're going to give ivermectin orally. And we also recommend with the deworming to do it based on the FOMACHA and the fecal egg count. And so that's why we don't rotational deworm anymore, because some of the animals are not going to need to be dewormed, right? And so we have a lot of farms that we go to and we do fecal egg counts once a month or once every 2 months. And we only deworm the animals that require it based on their egg counts. So some alternatives and additions to deworming that you can use are going to be copper oxide boluses. The dose is based on the age and not the weight. So that's different than, I would say, the majority of our medications out there. It's a slow release capsule. And what this does is the copper oxide is released slowly, and so it damages the parasite's cell membrane. And then this disrupts the parasite's metabolism, and then it causes the parasite to die. The copper oxide is different than copper sulfate, and so it's a much lower risk for copper toxicity than the copper that we see in our minerals and things. There's also bioworma, and so this is a fungus, and it, I don't want to butcher the name, but it captures and consumes the parasite larvae in the manure, and so you feed it to them orally in their feed, you mix it, and then the fungus makes it all the way through the GI tract, it's defecated out, and then it becomes active when the larva hatches in the manure, and so then the fungus also sporulates, then the fungal web is made, and then it consumes the larva. The animals that respond the best to this are going to be young animals and then pregnant animals. And so these are animals that their immune system is a little immunocompromised. So a lot of times those parasites are less resistant. And then the one big thing about bioworma is it is a little bit expensive. I have a few producers that use it and really like it, but it is a little bit cost prohibitive. And so the way to use this is that you will do fecal egg counts on your goats or sheep before you give this to them. And then you deworm any animals that you identify need to be dewormed. And then you're going to move them to a clean pasture. And then you're going to feed the bioworma daily. And so it's recommended for temperatures that are greater than 40 degrees Fahrenheit. And so in the South, that is the majority of the time. So if you're trying to use bioworma, it recommends doing this in the hottest parts of the year. If you're in the Southeast, often that is almost year round. And so again, it is a little bit cost prohibitive. And so it's a little bit difficult to feed it year round down here. But if you're in a location that has a great like seasonal distribution where it's only warm in a few months, for a few months of the year, I think it's a really good option. And the clients that we have that use it really, really like it. And then you'll monitor the fecal egg counts to see which animals that it's working well for, to see which animals are your chronically high shedders and things like that. So now we're at our second question.
Yeah, now they are answering in the poll. I think most of the people answer. I will be ending. Share the results. Yeah, so most of the people saying that all of them, B, C, and D.
Excellent. Yeah. And so these are all things that we want to do when we think about parasites. So we deworm them based on the combination of our FOMACHA and our fecal egg counts. And then the FOMACHA is a way to help us evaluate the anemia status. And then we should do recount fecal egg counts in 10 days after we deworm them. In the 10 days, often they often fall on a weekend, right? And so from a veterinary standpoint, if you can't get your veterinarian out there to perform these in 10 days, it's okay if it's 12 or 13 days. It doesn't make that big of a difference. The thing I would tell you is that I wouldn't do it any earlier, and you might just not have that reduction that you truly were going to have. If you're at day 9, it's probably okay, but if you're only at day 4 or 5, you want to give them the best chance that they have to go ahead and reduce for you. One last thing about the McMasters, from a producer standpoint, we have a ton of producers that perform their own McMaster slide, and so there's a lot of resources online for producers about learning to do those McMasters. And I personally know as a veterinarian, I love helping producers be able to do that, and so I think that that's one thing you could ask your veterinarian about is will you teach me how to do McMasters, and that way you can always check it with your veterinarian and see if y'all got the same kind of answer and things like that. So when we think about body condition scores, these are really important going into the winter. And so the biggest thing about body condition, and I think I'm running behind in time, and so I'll go a little quick through these, but the biggest thing is that we've got to touch these animals to make sure that they're the right body condition. And so especially in our unshorn sheep, and then if they're on a really high hay diet, and so if they're eating a lot of hay, they're going to have a really big rumen, right? And so that rumen can be really misleading because it's located on the left side, but it has a ventral sac on the anatomy that comes over to the right side, and it can kind of give them that like figure 8 shape, right, where the two sides are kind of poking out on either side. And I have an image of a goat later with that. But when we think about body condition in goats, and sheep, we think about 1 to 5. So an 11% body weight change is equal to 1 change in the body condition score. So 11% of their body weight changes their body condition score pretty significantly. And so when we think of 1 to 5, it's a little bit opposite of our FOMACHA. So 1s are really thin, so not the best. And then 5 are going to be our obese animals, which again is not the best. We don't want them too fat, but 3 is going to be our ideal body condition. And like I said, don't let the rumen fool you. And I have some images in a minute that'll show you. And then when we think about how to evaluate, and there's some diagrams that we'll go through in just a minute, we're going to think about their lumbar spine. So back here towards the rump of the animal. And so you're going to be kind of past the rumen, and then you'll be able to feel the transverse processes which run off their spine here, and then their dorsal processes. This animal is one of my absolute favorite patients that we have. He's a very sweet goat. And I was looking at him one day and I was like, you're the perfect body condition. And so I'm sitting here telling you have to touch him, but look at this animal and he's perfect. But when you palpate this animal, he has fat cover over or muscle cover over these transverse processes. He has a little bit of fat cover over his ribs. And he's just a really great body condition. And so this to me is an animal that's a 3. And then the animal on the left here, the solid white one, she's going to be more like a 3.5 to a 4. She's got a little more fat cover than the last goat did. She also has rib fat cover. I know these animals, and that's the only reason that I know this from these images. She does have like a little bit less fat over her dorsal processes of her spine here, but I'm pretty sure this is one of our does, and so she's had several kittings, and so she's just a little bit older. And then this right here is one of our really big wethers, and he's a big guy, and so he is a 5 for sure. And I don't know that you can appreciate it in this image very well, but he has a very significant amount of fat over his ribs. He has fat over his transverse processes on those lumbar spine. And then you pretty much got to dig for rib or vertebrae on this guy. It's one of our wethers and our blood donors, a sweet goat. This goat here is also a really good body condition. But this is the image that I wanted to show you when we think about those rumens fooling you, right? Like if we have a really large herd and we're not getting to touch them and they're eating a lot of hay, they can have these big sacks of the rumen poking out from side to side, especially if they're pregnant animals. They'll have the big rumen, big uterus in there pushing everything and displaying it or displacing it kind of outward. And so this is an example of an animal that she is a good body condition. And again, I know this animal, but she does have fat cover over her transverse processes and over her dorsal spine, her dorsal spinal processes. But this is an animal that could very well end up being thin on you, even though they have a really big rumen. So when we think about this top image here, this is going to be those transverse processes that we were talking about on that lumbar spine. And then these are our dorsal processes where the fingers are underneath the pointer. This animal, I would say, is probably a 1 to a 1.5 if we're being generous. We can see every individual rib, and so it's a very thin animal. And so the image towards the right, so this diagram, it shows you kind of this fat cover that should be over the transverse process. And there's an image coming up that has the different 1 through 5s to show you what it'll look like on different body conditions. So here we are. So at the top on the left, so this is talking about feeling that dorsal process of the spine. And then the right is showing you the transverse process of the spine here, the part of the vertebrae that comes off side to side. And then the next image on the bottom right is going to just be kind of palpating to see how big of a divot do we have between that dorsal process and those transverse processes. And then, so the rest of these images show you a body condition of 1 through 5. And so we'll go through each of those. So 1, we're going to have a pretty big kind of divot from this dorsal spinous process to that ventral, or sorry, the dorsal to the transverse. So we're going to have a divot there, and it's going to be really easy to palpate. There's not going to be a lot of fat cover. There's not going to be a ton of muscle cover, things like that. And so you can see as we go from a 2 to a 3, we've got more fat filling out here. And then a 4 and a 5, it's going to be really difficult to feel these dorsal and transverse processes on these animals. And so these are over-conditioned animals, 4s and 5s, especially 5s. All right, so third question.
Okay.
And while everyone is answering that poll question, I just wanted to announce the winner of last week's raffle for the book, and it's going to be Miss Stacy Hissel this week. So we are out of the office for the vacation or for the holiday, but I will make sure to reach out to you, Miss Stacy, tomorrow whenever I get back in the office, and we'll get your book sent to you.
Is she here?
I believe so. I believe I
yeah,
saw her.
yeah,
Yeah.
she answered. Okay, okay. Congratulations, Miss Stacy. And we are ending the poll now. I'm sharing the results. So 89% say that 3 5s, the number 8.
Excellent. Yeah. So 3 out of 5. And so it varies a little bit with if you are pre-breeding or if you're during gestation for if you want like a 2.5 to a 3.5. But ideally, on average, a 3 out of 5 is what we want to see. Perfect. So on to hoof care. So routine hoof trims are a big part of this, and it's going to depend on your herd, what kind of land they're on, how much property they have to go. Do they live in a barn? Do they live, is it muddy? Are there rocks and things that are going to help grind that hoof down? Some herds that we see, we do hoof trims once a year. Some we do 2, but most often, at least in the Southeast, we're doing hoof trims on these herds probably every 2 to 4 months. But again, that's not in a gigantic producer setting. So it just depends on the animal. And then why do we do these hoof trims? We want to prevent disease, things like foot rot and white line disease. And so I don't have an image of foot rot or white line disease in here, but I love this image from the University of Arkansas of the foot, this drawing. And so when we think about trimming these feet, they have these perfect little triangular toes, right? And so the part that we want to take off is going to be this hoof wall here. And so this black portion right here, we want to take the hoof wall down to the level of the sole. We don't want to take a whole lot of sole off, but we want them to be kind of equal when we trim them. Very rarely do we, I say rarely, but not as commonly as taking off hoof wall. We do have to take off heel sometimes, just depending on the ground. I see a lot of wet feet because the ground is wet all the time. And so often we do see animals that have a little bit of excess heel bulb. But when we think about foot rot, we can see disease at the sole, and we can also see disease in the interdigital space. Sorry, see it in the interdigital space. And so it has a very characteristic smell. And so when you see things like that, it's a good time to call a veterinarian. They can talk to you about how to treat those and what to do from a management standpoint to try to decrease that going forward. When you think about the toe when you're trimming feet, you'll kind of take it back to the point here to have that triangle again. And then when we think about white line disease, so white line is our separation between the hoof wall and the sole. So in this illustration where they have it as a true white line, you also hear this called gravel, but what happens is that you have separation between the wall and the sole, and then dirt gets pushed up in there. Dirt, feces, mud, any type of thing. Sometimes there'll be a little rock stuck there. But we see a ton of white line disease in the Southeast. And so the important thing when you're trimming these feet is that if you have hoof wall that is disconnected from the sole and there's dirt there and you can get your nippers up under there, you can go ahead and take that wall off. And it's always really scary to the students when we do this, because we do take a lot of hoof wall sometimes with that white line disease, but we have to, just because if we don't, then it just continues to pack into that crevice between the wall and the sole, and then it just keeps furthering the separation. And then sometimes you'll even see it where it goes up to the coronary band, and that's when you get that gravel because it comes out of the coronary band. But so can trim that hoof wall off if the separation is there. So just some images of how to restrain these guys. And so rumping the sheep is wonderful, and the students always love learning how to rump the sheep. This is my favorite way to trim sheep feet. This in a sheep deck, and I have an image of one of those in a moment if you haven't seen one. I only got introduced to those probably 2 years ago after having been a veterinarian for 4 or 5 years, and I was like, how have I never seen this with sheep? Because it's incredible, and the sheep handle it so well. But you can rump them and then have access to all 4 feet. And then here's that sheep deck here. They truly just sit down in it, and they handle it very well. And the deck latches onto the fence, and in a perfect world you can do it by yourself, but having 2 people, one person to help hold the sheep in the deck, and then one person to trim is really great. We've also used it on some of the smaller goats in our herds, and they actually handle it really well too. The horns usually cause a little bit of a problem because they get caught in the net a little bit, but a lot of the goats handle this better than being restrained and just held. And so I love a sheep deck. These are the nippers that you can get to use for the foot trims. There's all kinds of variation out there. You can get some that have like textured handles and things like that, whatever needs you may have. And then we have a lot of producers here that have made their own stands and things for their goats. And I really like trimming goat feet on a stand as well as the sheep deck. Anything to help your back, right, when you're doing lots and lots of foot trims. And then one image I don't have in here is the tilt table for sheep and goats. Those are amazing resources. We don't have a ton of producers around here that have them, but the few that do, they work really well. So a little bit on gestation management. So one big thing that is going to help you in a long run is doing pregnancy diagnosis to get the numbers of fetus, and so, or the number of feti. This is easier the earlier in parturition or the early in gestation they are, because we can see the individual fetus all in one view on the ultrasound. And so we can tell you that there's 3 right there looking at us, versus if they're closer to 120 days, it's a lot harder. They're up there 120 to 140 right there when you're getting that close to lambing or kidding. It's really hard to identify what fetus you're looking at. And so the earlier that we do it, the easier that it is. And so the reason that the number of fetuses is so important to us, one is that you'll know how many are coming. But then two, it's because pregnancy toxemia is a lot more prevalent with animals that are expecting twins and triplets. And so knowing that is going to help you navigate who to feed what. And so some of the gestational differences and requirements for energy when they're pregnant with twins and triplets versus singletons, it's really alarming. Like it is extravagant how much more energy that they need. So the female needs to take 180% more energy with a twin versus a singleton, and 240% more energy with a triplet with triplets versus a singleton. And so when we get animals that have triplets and we end up with pregnancy toxemia, it makes sense because the rumen is decreased inside because the uterus is so large because they have so many fetus in there, and they just run out of room to be able to eat and get enough energy. And so supplementing concentrate and kind of separating the animals that have triplets and twins versus the animals that have singletons is a really great way. And so that brings us back to our body condition score here. Is that we house the similar body condition scores together. So when we go out and we do the fecal egg counts, we go ahead and do body conditions. And so we put our 2.5s and 2s together if we have any that are thin, so we can increase their concentrate that they're being fed. And in the 4s and the 5s, the girls that are often highest on the hierarchy or the chain of command, if you will, in those herds are usually the heaviest animals. And so we can put them in a pasture of their own and then manage them kind of at the same level of grain or concentrate versus those animals that are a little bit on the lower body condition, can put those together and increase their concentrate and make sure we get them in that ideal body condition plane. So when we think about lambing and kidding, we want it in a clean, dry environment. We need to make sure they get enough colostrum. If you're having to supplement colostrum, make sure you use a replacer and not a supplement. The supplements they have a place, but if it's strictly for making sure they get that first colostrum, want to make sure you're using a colostrum replacer just so you don't end up with failure passive transfer. If you're worried about the kids not having nursed enough, so if they have triplets, what we can do is you can weigh the kids or the lambs to make sure that they're gaining weight. And so the first 24 hours, they may not gain weight on you, but every day after that, they should gain weight, roughly about 10% of their body weight every single day they should gain. So it's again, in a really high number or high volume operation, it might be difficult to do that. But if you have some that are struggling, that's a good way to know, are they getting enough milk? And then bottle babies, they are a little bit inevitable in a lambing or a kidding situation, but just have a plan. Like I said, use colostrum replacer versus supplement. When you choose your milk replacer, just make sure you follow the label when you go to mix it. We see problems if you don't mix it, or if people have not mixed it appropriately, then they end up with kind of neurologic problems because of the salt amount in there. So make sure that you follow the label. If you switch milk replacers, just make sure you change to the new label if you're changing brands or anything like that. And these bottle babies should be fed 15 to 20% of their body weight. If you're changing, you might want to decrease just a little bit and then go up just so you don't get a nutritional diarrhea. And then just a couple disease processes, and then we'll be finished. So pregnancy toxemia, we talked a little bit about it throughout this presentation, but it's a disease of the final trimester of pregnancy. It affects does and ewes. If the animal has previously had pregnancy toxemia, often they're more likely to experience it again, but that's often because these girls are the ones that have twins and triplets routinely. And so it's an inability to consume enough energy, and then the animals end up in a negative energy balance. They become ketotic. And so this is more likely to happen in thin or obese animals. So again, going back to that body condition score, if we have those animals at a 3 out of 5, hopefully we can kind of navigate not ending up with pregnancy toxemia. And then we talked about the gestational differences. I just put it in here again because it truly is an alarming percentage that they have to take in. And so what y'all will see on the farm is that they may be depressed, they may stray away from the herd, they may have a decreased appetite. If they stop eating, there is definitely concern for pregnancy toxemia in these pregnant does and ewes. And so things you can do to identify it is a urine ketone. So if they have urine ketones, that's going to be indicative of, hey, we're developing pregnancy toxemia and we need to start addressing it. And then prevention. So all the things that we've talked about kind of come together with this disease. So ensuring adequate body condition, and then making sure that they've got high quality forage, whether that's hay or grass, and then supplementing the concentrate so we can increase energy in that way. And so we're supplementing grain to try to increase energy. And then identifying those high-risk females, so the ones that are going to have triplets and twins, and then our obese or thin animals. And then one last thing before we finish, so urolithiasis. I wanted to talk about this because in the winter we end up supplementing, right, because we don't have as much grass. So we end up supplementing with grain. This is a disease that affects males. 99% of the time it's males versus females. And so these are bladder stones. It can happen in intact or castrated males. It can happen anytime, but I do think we see more cases in the winter because we are supplementing grain. And then also this is often in the post-breeding season as well, because they've lost weight because they've been out breeding females and they're not eating and consuming as much. So what you'll see is that the animals can appear to be straining to urinate or defecate. Often it looks like they're trying to defecate, and they'll have their tail up, and then they'll look like they're trying to defecate, but they're trying to urinate. And if you are seeing this and their tail is up, you can place your hand right below their rectum, and a lot of times you can feel the pulsing of the urethra trying to push the urine through, and then you're like, oh, got urolithiasis. Their back also may be arched, and a lot of times that's in pain. And then you may or may not see urine. Sometimes they'll be arching and acting like they can't urinate, and they'll dribble urine, and so maybe we have a bit of a partial blockage. And so when we think about prevention of this, we need to limit our grain intake. Some of our clients will use ammonium chloride in a pulsatile manner. Ammonium chloride is an oral supplement that helps acidify the urine, and it works really well for struvite stones. It doesn't work for all of our stones, but the most common stone is a struvite and a small ruminant, and it does work really well for that. The thing with this is if you're going to use it, we recommend you doing it in like week intervals. So you do it for a week and then you go off of it for 2 weeks. And so otherwise they become a little bit, I want to say resistant, but that's not the right word. They stop responding to it as well. And then want to limit our legume forages, so our things like alfalfa. And then there's also a genetic component to it. We've seen animals as early as like 2 weeks old have urolithiasis, and so it's kind of wild. The smallest one that I've ever seen was a little 4-pound goat buckling, and these are usually surgical corrections, and so or surgical treatments, and so they're not a good deal. But there can be reproductive life after urolithiasis when it's successful. I was going to show you this image of the small ruminant penis just so it makes sense of why the bladder stones cause such a problem. So the bladder stone enters the urethra, and so at the end of the small ruminant penis, we have this vermiform appendage here, and so it's just an extension of the urethra. And what this appendage does is it sprays semen on the external cervical eyes of the female. It kind of does it in a circle-like fashion. And so if you ever have a goat that has urolithiasis and you hear someone talk about removing the vermiform appendage, you can remove this because this is the most narrow portion of the urethra. And sometimes that's where the stone is stuck. And so if the stone is right there and you remove it, often they'll go ahead and urinate. And that's honestly the best case scenario when you get these guys that have urolithiasis. And then medical treatment follows after that. Things like acidifying the urine with ammonium chloride and providing IV fluids and things to how to filter the kidneys out. And then, so the veterinary client-patient relationship, I just wanted y'all to know that we are there for y'all. We want to do everything we can to help you have the best herds that you can and have the healthiest animals that you can. Preventive exams are amazing because then we have our client relationship, our veterinary client relationship already there. So when you have a sick animal, you call us and you say, hey, this is what I got going on. And sometimes we can talk about it on the phone. You decide if it's an emergency and then decide when we're going to come out. And I saw this explanation or quote from the AVMA, and I really liked it. And so I was just going to share it with y'all. It said the veterinarian is personally acquainted with the keeping and care of the patient by virtue of a timely examination of the patient by the veterinarian. So our preventive care, right? So we come to your farm, we know y'all all the things. And then it says medically appropriate and timely visits by the veterinarian. So these are going to be our sick patients, right? And so I really liked this because it brought it all together about preventive medicine and treating the sick ones. And so I think all of your veterinarians want the best for y'all, and I do too. And so just having that client relationship or that veterinary client relationship so that when you do have a problem, you can pick up the phone and call us and we're like, okay, let's figure this out. And then it's not the middle of the night and you don't have a veterinarian yet to be able to call. But yeah. And then comes to our last question.
Okay. Let it go. I think I will be ending the poll. So most of them say A. All of them say A.
Excellent. That's perfect. That's exactly right. Well, thank y'all so much. I hope this was helpful, and thank y'all so much for having me here tonight. I've enjoyed it. If y'all have any questions or if you ever need anything, there's my email, and I'm always happy to chat about anything.
Yeah, and
Yeah, so
there are some questions
I
right
was
now.
gonna say we do have a few questions if you don't mind. You seem like
Sure.
you were on a roll, so I didn't want to
Oh no, you're
interrupt.
fine. Sorry, I went over a little bit too. No, let's do it. Yeah.
So let's go back just a little bit. And let's see. Uh, I know Dr. Acharya tried to respond to some of these questions for you guys. Um, we did discuss using the copper oxide bolus, and that you seem to have found that to be effective. Um, she said that she had read the study and she was curious if there were any more studies that supported this. Um, let's see, that they used the copper oxide bolus, but was wondering if you had found that to be effective.
I think that it depends on the herd. I think that it's all a combination, right? And so I joke that the more I learn about parasites, the less I'll know about them because things that work all the time with some herds don't work with others. And it's like this is the same situation. Why can't it work? And so I think that in our university herds, they work very well. And so, but we have very strict like protocols for our animals and things. And so I think that that plays a role in it. But I think it all comes together as one entity of you have to do it all. And so it can be a little bit frustrating for producers and for us too, because we have several herds that I personally go to that we do fecal egg counts multiple times a year, and we still have some animals that have problems. And so for several of our herds, it has made a very big difference. And we've seen lower egg counts and we've had to deworm less animals, especially in our university herds. We have probably, I think we have like 70 or so small ruminants. And we very rarely have to deworm now. And so they do get copper boluses twice a year. And I personally think it has made a big difference because I think we implemented that a couple years ago and it truly has changed it. And so I think it's the ultimate answer is it depends on the herd. And so that again is a frustrating answer, but I don't think it's wrong to try it and see if it makes a difference. And if it doesn't, then you don't have to do it again.
Gotcha. Okay. Then we had one that if you're on the white line separation, would using iodine or copper foot treatment help after trimming?
For sure, you can definitely use both of those. I'm sorry I didn't include that in there, but you can. Things like the copper sulfate. You can do foot baths as well. And often with the foot rot, we end up doing systemic antibiotics just depending on how bad it is. But if you have the ability to keep them dry, you can use bandages and put those on them and wrap the feet. Often that helps too, but you can definitely use both of those.
Okay. Um, on the topic of colostrum replacer, we did have a reply saying that there was one for kids and lambs, but is there a specific goat brand? Like, would you suggest using goat specific colostrum replacer?
Yes. So we use the and I have like no affiliation with them, but the brand that we use is the Land of Lakes. And so we really like that for that's what we use for our client animals and for our university animals whenever we have to supplement. But that's the brand that we use, and we do use the small ruminant versus the bovine.
Okay. Do you have as far, Jill was asking, when you put the nutritional requirement changes for uh, doubles and triple or twins and triplets, if you had one for quads and quints?
Oh, I do not, but that is a really good question. Since those double, I would say that they would continue to double in the same, like the same fashion. That,
Right.
that being said, one of the most that I've ever seen. So there was one goat years ago when I was a resident, and we had five in that, and it was a goat that had pregnancy toxemia, but we that's the most I've ever seen. But I do not have a nutritional percentage for those. I'm sorry.
Okay. Um, let's see. Let me just make sure I'm covering everything. Uh, how often should kidding jugs be cleaned and rebedded?
Kidding jugs as in like where they're kidding.
I believe so, yeah.
Okay. Um, I personally would, and I'm not familiar with that term, but I presume that that means like the actual kind of pin where they're kidding. I would I would do it after the kidding, and so I would let one animal kid. If you're speaking about an individual pin, I would let that animal kid clean it and then let them go back in.
Okay. Let's see. I think the last one that I'm seeing here is she was curious about the how you felt about the mineral buffet as opposed to the mixed loose. I think you had mentioned that you kind of preferred the loose mineral over the um, like the tubs just because of the less additives, but she was asking if it was a fad or actually better.
So I'm not a nutritionist. I'm just going to give you that caveat. But the information that I've gotten from nutritionists is it always seems like you get more for your money with the loose mineral because so much of it is molasses and things like that in the tubs. I think the animals love the tubs, and so the producers that we have that feed the tubs, they they always have it all over their faces and everything, and so they definitely
Oh,
like those tubs. But the other thing about the loose mineral is that they're self-limiting, so you don't have to worry about them eating too much. And so I guess it just depends on probably the brand that you're purchasing also. And so I am by no means the guru of the
okay.
additives in those, but that's just the gist that I've gotten from the nutritionist is that there's more minerals for your money versus the tubs.
Okay, so I think she was trying to say a buffet versus mixed loose mineral, where they would be has the mineral buffet has individual loose mineral components, so they don't have all the minerals in one.
So it's like a almost like a trough with separated.
Right.
Oh, I've personally never seen one like that. Other than just like a salt block. The loose minerals that I've seen have always just been the like the packaged loose minerals. I've never seen one where you could mix it together other than in our dairy cows.
Okay.
Sorry, so I guess I don't have an answer for that.
That's okay.
Can you open your camera, Gabriel?
Oh,
Okay.
sorry.
Yeah, you're right. Well, I think we just came to the end. Was so great presentation, Dr. Waters. It was a pretty good decision to invite you for this talk. You are very proactive, you know a lot, and you have a very good future working in small ruminants and in your field. Thank you so much, Joe, for the people. We are to have our next talk. that will be from Virginia Tech, talking about selection for, let me see well. This will be Dr. Scott Grayner from Virginia Tech, ultrasound to predict carcass trait. So I think will be very interesting just to be knowing about this other field. And thank you so much, Dr. Waters, to be with us.
Thank y'all so much for having me.
Our privilege to have you.
No, thank you so much.
Thank y'all.
I enjoyed the talk.
And thank you for all the attendees. And I was pretty impressed that you were sharing information. So thank you for being participating. Yeah. See you.
Thank you.